Welcome back to Ethnic Health America. In this segment, we continue our Legends in Medicine. Our special guest is Dr. Frank Staggers. He's a retired urologist, but much more. He's the past president of the National Medical Association, past president of the California Medical Association, and the past president of the ethnic physicians in California. Dr. Staggers, welcome to our program.
Well, thank you, Mike.
Most importantly, you're chairman of the Ethnic Health Institute at Alta Bates Summit Medical Center, where I had the opportunity to work with you.
Thank you.
Tell us a little bit about your journey to medicine. Where did it start?
Mike, as long as I can remember, I've always wanted to be a doctor. Our family doctor was a little pediatrician who lived right around the block from me. And all my life I wanted to be a doctor. I didn't want to be anything else.
Now, when you started your journey in medicine, it wasn't as easy for African Americans to get in medical school. They were pretty much confined to two major schools.
Correct.
And the numbers of people qualifying for those schools we've heard in previous segments is there were maybe 3,000 or 4,000 people applying for very few spots.
Correct.
Now, tell us how you got interested in urology.
You know, I'm from Charleston, South Carolina, which is a seaport town. Navy ran that town. And by law, the only thing African Americans could be in the U.S. Navy were in the steward's branch. You were either a servant or a cook. Now, I grew up in Charleston, South Carolina. So when I went to medical school and had a chance to intern, I went to the Navy. I applied to the Navy and got accepted into the Navy as a physician. So that made me very proud. And because of that, I did my residency in the Navy. And I was sent from, did the internship at St. Albans, which is a naval hospital in New York, in Jamaica, New York. And then the next year I was sent to Japan, the Yokosuka, Japan. Navy had a hospital there. The only service they had that had a vacancy, I wanted to be a surgeon. You know, most of the time I love surgery. The only position they had was the urology service. So I took that. And after spending 2 years on urology, I began to like it. So then I decided I'd apply for urology, and you know, the rest is, as they say, is history. What
are some of the barriers you faced? I mean, obviously through this journey there have been instances of discrimination, instances of disparities in how you were treated. What are some of those barriers look like?
Well, Mike, I think the first barrier is education. There are 9 of us in the family. I'm the middle child. I think there's something in the birth order. But my mother and father really believed in education. And if you get your education, you can overcome the barriers that can be overcome. Either go over them, around them, or through them. So the first thing is, if you're going to get prepared, you have to be prepared. That's what my mother and father used to always say. Education is the first thing. So out of the 9, everybody got out of high school, 7 out of college, 5 with advanced degrees. So to me, whatever barriers we faced could be overcome because you were educated and you knew what to do and how to get a remedy. You follow me? So you have to look for solutions. The barriers are going to be there, still are. But you have to have, what is the solution to these barriers?
Now tell us a little bit about your career in urology. Obviously, lots of changes. Your interest has always been in prevention, early detection, and the prostate is kind of the key element for African Americans in urology, isn't it?
It is. Well, I think that you know, we're not trained to do community medicine. No, we train in prevention. When I came along in medical school, that came about later. And I think it came about because of what we were doing with prostate cancer. Prostate cancer was a disease that was already metastatic, already spread until the 1980s when we got the PSA, prostate specific antigen test. And then since that time, when we did mass screening using the public policy that what public health does, being out of the office, going to where the patients are, doing mass screenings so that you can get to a lot of people and provide that opportunity for them to be tested or screened early. That's how you can affect and prevent certain disease. You may not be able to prevent it, but you can detect it early. So we got that and had that information. Now you can apply that to any disease. There's a 10-year to 15-year latent period for all the chronic diseases. And if that is true, then we as physicians shouldn't be just waiting to treat the disease after the complications appear. We should be in the latent period, trying to prevent the disease or detecting it early. And that's the message that I think that most physicians who don't get it in medical school, we should begin to pass that on.
Was prostate cancer always disproportionate in African Americans throughout your career?
Absolutely.
And how would you manage it before we had?
Well, you didn't, because what you saw most of the time was about 5 to 10% of the men you saw were probably could be cured. That didn't mean they didn't live long, but you couldn't cure them because the disease was already out of the bond. but you had certain disease, certain medications and certain things you could do to prolong life. And even today, there's a big debate going on whether or not there should be community screening. Well, in our community, as you well know, most people don't have a private doctor in our community. They have clinics, or they don't see a doctor until there's an emergency, then they go in to see them. So we do believe that community screening is the way to reach these people and detect this disease early, because you can't cure these people if you detect it early.
Talk a little bit about your career in medical organizations. You've been president of the National Medical Association, the Organization of African American Physicians. You've been president of the California Medical Association, and founded the Ethnic Physicians Organization, or one of the founders, and the Ethnic Health Institute. Why so much community involvement?
Well, Mike, I think that first thing, I believe you need to have and be involved in your community. That means you have to be involved in the governance of your community. The only way to be involved in the governance community, you have to be involved in politics. Politics is what makes the world go around. When I was a boy growing up in South Carolina and I was being segregated against, discriminated against, the law was on their side. So my first thing was, then let's change the law. So you need to then, if that is the case, why not then continue to be active in political advocacy, political legislative affairs, etc. So I think that all physicians ought to be not only physicians, community leaders, and political advocates. Because if the one thing I think is the most important thing that we do, even more important even in the practice of medicine, is the political advocacy that we do.
And so that these things, if you found, you certainly have been rewarded. I think that in the sense that what you've been able to affect at the policy level has been significant. And as you look back on your career as a urologist, what stands out? Your whole journey.
Mother and father.
Right. Well,
that's the truth. Because again, to me, I still believe. My mother used to say all the time that you do the walking, let other people do the talking. And it's very hard to stay humble when everybody tells you how great you are. Don't believe it. Don't believe it. You are a very humble person, and you're just a small cog in the wheel. So you really need to do your thing, especially do it locally. Everybody can make an impression if you do what you're capable of doing, the gifts that God gave you. So my mother and father are very religious. And so I have a very good religious background and training. And I believe in using the gifts that God gave me. And it's easy for me to stay humble. I don't need to be out there beating the band or beating the drums. Because again, God was fortunate and gave me some great, great gifts. And I'm so appreciative.
Dr. Staggers, thank you very much for joining us on this edition of Ethnic Health America and this Legends in Medicine program. Certainly you've had a tremendous impact on my career, and certainly at the national, at the local level, you have made tremendous impact. So we are grateful for you taking the time.
Thank you, Mike, and the same is to you. You've been an inspiration, a professor, and a real, great thing for our community. Thank you so much.
Thank you for that comment. We'll be right back after this break.